The honourable member for Calgary-Curry.
Thank you. To you and through you, Mr. Speaker, I would like to introduce several counselling therapists providing invaluable mental health services in their respective communities. I welcome Nicholas Renault from St. Albert, Nicole Imgrund, also from St. Albert and Chair of the Association of Counselling Therapists of Alberta, and Fred Tappenden, Principal and Dean of St. Stephen's College in Edmonton, one of the institutions offering a graduate degree in counselling therapy in Alberta.
The honourable member for Edmonton-Whitemud. Order. The honourable member for Calgary-Curry.
Thank you, Mr. Speaker. Albertans would be stunned to know that there are no minimum training standards and no oversight for the 4,000 unregistered counsellors practicing in Alberta. Since legislation passed unanimously in 2019, the UCP affirmed that this was a risk to the public, completed broad consultation, and developed the regulations for a College of Counselling Therapy of Alberta. But now they refuse to proclaim the college into being. Why is the Minister of Mental Health and Addiction withholding from Albertans the solution to increase regulated quality mental health counselling?
Good question. The Honourable Minister of Mental Health and Addiction.
Mr. Speaker, this government's not refusing anything, but we're listening. The truth is we received information in our engagement coming back from Indigenous communities, particularly Treaty 6, bringing some concern around moving forward too quickly. This is an important piece of legislation and regulation. As the member opposite noted, our purpose of having colleges is to work in the public interest, and we are going to continue to move forward on the file as we consult with a number of the different groups that are important stakeholders in this space. And I'm happy to work with the members opposite and the stakeholders that are relevant to make sure that we achieve this end as soon as possible.
The honourable member for Calgary-Curry.
College of Counselling Therapy aligns with the UCP mandate to increase the mental health workforce, and it is the government's responsibility to enforce basic safety measures in essential health services. And given that I will be tabling a petition with over 1,400 signatures echoing 8,500 letters already sent to the UCP government calling for equitable and safe mental health counselling through the proclamation of the CCTA, why is the Minister's office repeating its call for consultation, creating red tape, and withholding public protection?
Good question.
The Honourable Minister of Mental Health and Addiction.
Mr. Speaker, in the work we've done already, working with ACTA, we know that we've had non-for-profits, we've had all sorts of organizations that do delivery on the ground, we've had charities give us feedback saying they want to make sure this proceeds in a thoughtful, appropriate way. It is not red tape to listen to Indigenous communities. Different from the members opposite, we believe partnership, not imposing but proposing with our community members is the best way to move forward, and that is what you're going to get from this government, a thoughtful, continuous move forward on policy to make sure that we are looking after the public interest and at the same time regulating those professionals.
Member for Calgary-Curry.
Given that consultation has already been ongoing for 5 years, and given that regulation costs the government nothing since it's self-funded by the professionals, and given that ACTA has completed all the necessary steps as directed by legislation and this government, and given that Albertans are facing an affordability crisis and services can't be covered by third-party insurance or First Nations and Inuit non-insured health benefits until counsellors are regulated, when will the minister cease the stalling tactics and commit to basic safety and quality assurances by finally endorsing the proclamation of a College of Counselling Therapy of Alberta?
The Honourable Minister.
Mr. Speaker, as I stated before, we're very happy to work with any stakeholder that wants to move forward on protecting the public interest when it comes to regulating our health professionals. My office in the ministry and the department have been in regular contact over the past month with ACTA and with relevant stakeholders. We are not going to impose a solution on our Indigenous community, on our non-for-profits, on those who work in the mental health space. I want to thank every single counsellor that does the work that they do in helping the mental health of Albertans. I want to make sure all Albertans have access to it and that we're regulating in a way that is thoughtful and protecting the public interest.
Order.
Presenting reports by standing and special committees. Presenting petitions.
The honourable member for Calgary-Curry has a petition to present.
Thank you, Mr. Speaker. It is my pleasure to present a petition with 1,443 signatures from all across Alberta that urges the government to proclaim in force Section 29 of the Mental Health Services Protection Act, which would establish the College of Counselling Therapy of Alberta. Right now, in Alberta, anyone can call themselves a counsellor and provide counselling therapy services to vulnerable people seeking help. There are no standards for education or training. This petition echoes the 8,500 letters already sent to the government, including letters of support from the rural municipalities of Alberta, educational institutions, counselling therapy employers, Canadian third-party insurance companies, and 12 different counselling associations in Alberta. This government has already completed the consultation and prepared the regulations. They called on ACTA to ready the college for opening and to grandparent the profession. The work is done and the college is ready to be...
If the member wants to make a statement in the House, she can do so at member statements. Presenting a petition needs to be done probably twice as quickly. I was very generous to you today, but I appreciate your remarks. Are there other petitions to be presented?